I want to take a step back and talk a little bit about kind of why I think we need this. And part of it is because, I talked about the physician shortage that's upcoming, at least in the United States, right? With our growing elderly population, less and less people going to medical school compared to how many doctors we actually need. And there actually is not really a feasible way to increase enough training spots to meet that demand, right? So we know that you're not going to be able to push more people into medicine at a rate that would actually meet that demand. Also, 10 years is almost one training cycle. So it's basically the doctors who are going into training right now. And so it's interesting. There was actually a study that was done in the Annals of Family Medicine that essentially did an estimate of what is a reasonable patient panel for a primary care physician. And I thought it was really interesting because they did it based off of an assumption of how many tasks you could actually delegate away from the primary care physician. And one of the things they showed was if you could delegate 77% of all preventive care away from a primary care physician. So another team member is taking on that. And 47% of chronic care also gets delegated away. That essentially would mean that your primary care as a team could take on about a little over 1,900 patients, which is really interesting because right now what we're seeing is that on average, there's actually a lot of studies about what is the average patient population or panel for a physician in the US. We usually quote 2,500 as the average. I don't think that number is actually based on anything, but a recent meta-analysis said it could be anywhere between 1,200 to 3,600. And so if you're looking at all these models where maybe it's concierge medicine, where you're seeing a much smaller patient panel versus a super busy practice, up to 3,600 patients, that's basically assuming that you have a huge team where you're able to delegate the vast majority of tasks away, which is actually not really reasonable. And that's actually where I would love to see a lot of the AI space come into play here, to start to see what can we actually do to help a primary care physician expand the panel that they're able to take care of. And it's probably not going to be a one-on-one, patient relationship. It's probably going to look a lot more like population health management.